In this video, I'll show you the 5 worst exercises to avoid if you have an L4-5 or an L5-S1 disc bulge. These common exercises can put extra stress on your injured disc and may even make your back pain or sciatica worse. Make sure to watch until the end because for every exercise you should avoid, I'll also show you a safer replacement that can help you stay active, build strength, and protect your lower back while it heals. Hi, I'm Dr. Tam Lee, chiropractor here in San Jose, California. Before we get into the list, it's important to understand one simple principle. Most L4-5 and L5-S1 disc bulges become more irritated when you repeatedly load the disc in positions that increase pressure on it. That usually means exercises that involve bending your lower back forward, bending sideways, or lifting heavy weight through your spine. Those movements, they can place extra stress on an already irritated disc, making your back pain and your leg sciatica worse. That's why I routinely tell my patients to avoid these exercises, especially during the early stages of recovery. Instead, I have them focus on movements that keep the spine in a more neutral position while strengthening the muscles that support the lower back. And the very first exercise on this list is one I recommend avoiding more than any other: sit-ups. This is probably the most common exercise I tell my patients with an L4-5 or an L5-S1 disc bulge to stop doing. Every time you perform a sit-up, your lower back repeatedly bends forward into lumbar flexion. That forward bending significantly increases pressure on the discs in the lower back, especially at the L4-5 and L5-S1 levels where your disc bulges occur most often. If that disc is already bulging or irritating a nearby nerve, repeatedly loading it in this position can increase inflammation and make your symptoms worse. You may notice increased low back pain, pain that travels into your buttock or leg, numbness or tingling, or even sciatica after doing this exercise. While one set of sit-ups is unlikely to cause a disc bulge by itself, repeatedly performing this movement on an already injured disc can slow healing and continue to irritate the injured tissues. Instead, replace sit-ups with a prone plank. A prone plank strengthens the muscles that support your spine without repeatedly bending your lower back. Rather than creating movement at the injured disc, it teaches your deep abdominal muscles, back muscles, and glutes to stabilize your spine in a neutral position. That is exactly what we want during recovery from a disc bulge. To perform a prone plank, lie face down on the floor and place your forearms directly underneath your shoulders. Lift your body onto your forearms and toes while keeping your body in a straight line. The straight line is going to go from your head to your heels. Brace your abdominal muscles as if you are preparing for someone to gently poke you in the stomach. Avoid letting your hips sag towards the floor or lifting them too high. Continue breathing normally throughout the exercise. Hold the position for 15 to 30 seconds and repeat it 3 to 5 times. Now, as your strength improves and your symptoms settle, you can gradually increase the hold time and the reps. With this exercise, you should feel your abdominal muscles, your sides, your shoulders, and your glutes all working. You should not feel increased low back pain or worsening leg pain. And if your symptoms begin to travel farther down your leg while performing the exercise, stop and speak to your healthcare provider before continuing. The second exercise to avoid is the barbell deadlift. Now, this surprises a lot of people because deadlifts are often considered one of the best exercises for building strength. While that may be true for a healthy spine, they are usually not a good choice if you have an L4-5 or an L5-S1 disc bulge. A properly performed deadlift is a hip hinge exercise, but it also places significant compressive load through your lumbar spine. Even with good technique, your lower back must resist very large forces while supporting the weight of the barbell. If your disc is already injured, those heavy compressive forces can further irritate the disc and increase pressure on the nearby nerve root. If your technique begins to break down because of fatigue or too much weight, your lower back may also begin to round forward This combination of heavy compression and lumbar flexion places even more stress on the injured disc and can lead to increased lower back pain, muscle spasms, or a worsening of your sciatic symptoms. Instead, replace barbell deadlifts with glute bridges. Glute bridges strengthen your glutes, hamstrings, and posterior chain without placing heavy compression through your lumbar spine. They also teach you to generate force from your hips while maintaining a neutral spine, which is an important movement pattern for protecting an injured disc during recovery. To perform a glute bridge, lie on your back with your knees bent and your feet flat on the floor, about hip width apart. Rest your arms comfortably at your sides, tighten your abdominal muscles, then press through your heels and squeeze your glutes to lift your hips off the floor. Raise your hips until your body forms a straight line from your shoulders to your knees. Pause for 3 seconds at the top, then slowly lower back down to the starting position. Perform 3 sets of 10 repetitions using slow, controlled movements. The third exercise to avoid is loaded squats. Whether you're performing back squats, front squats, or goblet squats with heavy weight, these exercises place a large compressive load through your lumbar spine. During a squat, the weight is transferred from your shoulders through your lower back into your legs. If you have an L4-5 or an L5-S1 disc bulge, that added compression can increase pressure on the injured disc. As the weight gets heavier or fatigue sets in, it's also common for people to lose their neutral spine and begin rounding their lower back at the bottom of the squat. That combination of compression and lumbar flexion can further irritate the disc and the nearby nerve root, leading to increased lower back pain, stiffness, or pain, numbness, and tingling that travels down your leg. Instead, replace loaded squats with wall squats, also called wall sits. Wall squats allow you to strengthen your quadriceps, glutes, and lower leg muscles while significantly reducing the load placed on your lumbar spine. Because your back stays supported against the wall, it is much easier to maintain a neutral spine throughout the exercise. This lets you build leg strength without placing unnecessary stress on the injured disc. To perform a wall squat, stand with your back against the wall and place your feet about 2 feet in front of you, roughly shoulder width apart. Slowly slide down the wall until your knees are bent to about 45 to 90 degrees, depending on what feels comfortable. Keep your back, shoulders, and head in contact with the wall. Tighten your abdominal muscles and avoid leaning forward or rounding your lower back. Hold the position for 20 to 30 seconds. Then slowly slide back up to a standing position. Repeat this for 3 sets. As your strength improves, you can gradually increase your hold time. With this exercise, you should feel your glutes doing most of the work, along with your hamstrings and core. You should not feel pinching in your lower back or increasing pain that travels into your leg. Now, if you do, lower your hips slightly and focus on squeezing your glutes rather than arching your lower back. The fourth exercise to avoid is the seated hamstring stretch. Now, this surprises many people because stretching often is thought to help back pain. However, if you have an L4-5 or L5-S1 bulge, this particular stretch can actually make your symptoms worse. When you sit on the floor or on a chair with your legs straight and you reach forward towards your toes, your lower back naturally rounds into a lumbar flexion. Now that forward bending increases pressure on the lumbar disc and can place additional stress on an already injured disc. If the bulging disc is irritating a nearby nerve, this position can also place more tension on the sciatic nerve, leading to increased leg pain, numbness, tingling, or a pulling sensation down the back of your leg. Instead, replace the seated hamstring stretch with a wall hamstring stretch. The wall hamstring stretch allows you to lengthen your hamstring muscle while keeping your lower back supported in a neutral position. Because your spine stays flat on the floor, you can improve hamstring flexibility without repeatedly bending forward and increasing pressure on the injured disc. To perform this stretch, lie on your back beside a wall or in a doorway. Place one heel against the wall and slowly straighten that leg until you feel a gentle stretch along the back of the thigh. Keep your opposite leg relaxed and on the floor, and make sure that your lower back stays flat throughout the stretch. If you need a stronger stretch, simply move a little closer to the wall. If the stretch feels too intense, move slightly farther away. Hold the stretch for 10 seconds, then relax. Repeat 3 times on each leg. With this stretch, you should feel a gentle pull in the back of your thigh. You should not feel increasing lower back pain or worsening pain that travels down your leg. If your symptoms become more intense or begin traveling farther down your leg, ease off the stretch and stop altogether. The 5th exercise to avoid is oblique side bends, especially when performed while holding a dumbbell or a kettlebell. Although this exercise is often recommended to strengthen your core, it can place unnecessary stress on an L4-5 or an L5-S1 disc bulge. As you bend your trunk from side to side, your lumbar spine moves into lateral flexion. When you add weight, the compressive force on one side of the disc increases even more. If the disc is already bulging and inflamed, repeatedly loading it in this position can further irritate the injured tissue and nearby nerve root. This may increase low back pain and, in some people, make your sciatica symptoms such as leg pain, numbness, or tingling more noticeable. Instead, replace the oblique side bend with a side plank. The side plank strengthens the oblique muscles, quadratus lumborum, glute muscles, and other core stabilizers without repeatedly bending the spine from side to side. Rather than creating movement through the injured disc, it teaches your muscles to stabilize your spine in a neutral position. This improves core strength while placing much less stress on the lumbar discs. To perform a side plank, lie on your side with your elbows directly underneath your shoulder. Keep your legs straight and stack your feet on top of each other. If this position is too difficult, you can bend your knees to 90 degrees and perform the exercise from your knees instead. Tighten your abdominal muscles and lift your hips off the floor until your body forms a straight line from your shoulders to your feet or knees. Keep your head, shoulders, hips, and ankles aligned and avoid letting your hips drop towards the floor. Hold the position for 15 to 30 seconds, then slowly lower back down. Repeat 3 times on each side. As your strength improves, gradually increase the hold time. With this exercise, you should feel the muscles along the side of your abdomen, your glutes, and your shoulders working to keep your body stable. You should not feel increasing lower back pain or worsening pain that travels into your leg. If your symptoms increase, stop the exercise and try the modified version with your knees bent or speak with your healthcare provider. Today, we covered the 5 worst exercises you should avoid if you have an L4-5 or an L5-S1 disc bulge, along with 5 safer replacements that can help strengthen your body while protecting your lower back. By avoiding exercises that repeatedly bend or heavily load your lumbar spine and replacing them with spine-friendly alternatives, you can stay active while reducing unnecessary stress on the injured disc. If you found these recommendations helpful, which replacement exercise did you like the most? Was it the prone plank or the side plank? Drop a comment below, let me know. If you found value in this video, please give it a like and share it with someone dealing with an L4-5 or an L5-S1 disc bulge. Doing so helps more people find practical, non-surgical solutions that may help them move better and feel better. Remember to subscribe if you want more tips on how to protect your spine, better understand your condition, and learn the treatments that help people find long-term relief. If you'd like to learn even more exercises that can help relieve pain from an L4-5 or an L5-S1 disc bulge, go watch this video next. I'll show you my 10 best exercises for an L4-5, L5-S1 disc bulge, explain why they work, and how we use them to help patients reduce pain, improve mobility, and get back to doing the things they enjoy.